So what's the answer, Dr. Dan Stock? What about your colleagues? Can they continue to practice in the traditional environment with ethics?
So the one thing whenever I do a lecture, I tell patients, I know you're sitting around waiting for your doctor to save you. And let me tell you what has to happen first is you have to save him. I don't think people realize that the average medical student coming out of medical school right now is $350,000 in debt. If he goes to work for a health network for 10 years, he can get that forgiven. But if he works for that health network for 9 years, 11 months, and 29 days, and they fire him, if he doesn't get hired by another hospital in 2 days, all 10 years of that debt come back.
So and this is, excuse me to interrupt, but that's by design.
Yeah, it's right. Again,
literally, the system creates slaves so they can control the doctors.
You can only get so stupid for free, right?
Yeah.
So I tell people, look, what you need to do is to get involved with your legislature and change the laws. And you have to know how to get involved with your legislature. And this is my other area of experience. I've been actually lobbying the Indiana State Legislature since 2015 on behalf of the Convention of States organization. And through that, I have learned why legislators don't serve their constituents. And so people need to go with a legislator and attack the fundamental. I'm a functional medicine doctor, so I get root cause stuff first. You need to find the root cause of why your legislator has passed these laws that allowed this nonsense to go on. And so I beg people, first of all, look at the rules of the chamber of your legislature. And what you're going to find right now is the way your legislator works is that you guys all give your power to this legislator who marches into the chamber and promptly gives away all of your power to the leader of that chamber through the rules. And immediately, as soon as that leader has all of that power, the crony capitalists and their lobbyists land on him. And it's tempting to want to say, well, he must be an evil man. But I tell people, you don't understand what he suddenly has pressure-wise on him. And so the first solution you have to do before you ever have a chance of getting a law passed to make medical freedom come about, before you can rely on that doctor, you have to go to your legislature and say, I know how this thing works. The good bills all die in committee. They never get debated. They never get voted on, so that I can't hold you accountable. And the first thing I want you to do is to change those rules of the House and Senate in your state. We need that to go on like steroids over what happened to Mr. McCarthy in the United States Federal House. We need that to happen in every state legislature, because now when that power is taken away from the leader and distributed back to the individual legislators, we can hold them accountable for what they do and don't do.